Today is World Prematurity Day, and for the first time in 8 years, the U.S. is seeing an increase of premature births. News 8's Sarah Tamer sat down with local doctors today. She now joins us with the details. Sarah?
Martha, according to a new report by the March of Dimes, Wisconsin is one of 7 states to see an increase of preterm births since 2014. Despite medical advancements to prevent preterm births, the U.S. currently lags behind some less developed countries. Preterm births are the largest cause of infant deaths in the U.S., and preventing them seems to be a bigger challenge now than 8 years ago.
There's a wide variety of reasons why babies are born premature. Some of those reasons are preventable. For example, not performing elective deliveries before a baby reaches their due date.
But Dr. Richmond says other reasons are harder to tackle.
So for example, in Wisconsin, a woman of color has a 44% increased risk of having a baby born prematurely. This, of course, is also related to socioeconomic status, insurability, and access to good prenatal care.
Premature births typically happen when a child is born before 37 weeks of pregnancy. In 2015, preterm births in the U.S. increased from 9.57 to 9.63%. But Gunderson doctors say there are some measures expecting mothers can take to help prevent that number from growing.
To get prenatal care early and to provide a good history, especially if you had preterm labor in a prior pregnancy. Give your physician all of the information that he or she would need, or your midwife, provider, and so that some of those things can be identified. Certainly a history of a preterm delivery will increase your risk in a subsequent pregnancy.
Premature babies born earlier and smaller are at a higher risk of not surviving and being discharged from the hospital. And doctors say the smaller the baby, the bigger the challenge.
All of their organ systems are born immature, particularly their lungs and their heart. They often need to be intubated, breathed with a respirator, and given lots of medicines to help essentially take them sometimes through their whole 3rd trimester of pregnancy outside the womb.
And to help get rid of this epidemic, providers say different measures have been in the works, but it'll most likely take 5 to 10 years to see results.
Cervical cancer screening has become much different now, such that we are not intervening as early to do procedures on women's cervixes that can cause preterm labor in a subsequent pregnancy.
According to the March of Dimes, the U.S. should lower the rate of preterm births to 8.1% by 2020 to be among countries with the lowest rates.